What's up, everybody? This is Dr. Bartu with PillTalkPodcast coming to you live. Letting you know here, I got a special guest, Dr. Katrina Byrd, a med-peds trained infectious disease physician, coming today to give you guys a little insight on her life and what she does. So she's going to give you the daily dose of medicine that you need to be inspired and live at your full potential. So how you doing, Dr. Byrd?
I'm good. How are you?
I'm good. I appreciate you taking the time to come on to the Pill Talk podcast today.
No problem. I'm happy to be here.
Great. All right, Dr. Byrd, let's start this off. What made you wanted to become a doctor?
Okay, that is an excellent question. So I'm originally born and raised in Detroit, Michigan. I have an identical twin sister, and both of my parents are teachers. So they really enforced, education, and they went out of their way to put us on all these educational programs outside of school. So I remember I was in high school, my mom was like, okay, well, I signed you and your sister up to go to this biomedical symposium in Nashville and y'all leave tomorrow. And I'm like, what? I want to hang out with my friends. I want to watch TV. I don't want to go. You don't have a choice. It's already done. And so I said, okay. So I went down there and it really changed my life. I had so many great experiences, but one of the most memorable experiences was listening to the current CDC director, Dr. Julie Gerberdine, give her speech. So I don't remember all the details. I remember she just kind of talks about the top kind of public health issues, including SARS that was going on. And I just remember being in awe. I was so inspired. I'm like, who is this woman and how can I be her? What do I have to do? And so then I found out she was a physician, an infectious disease physician. And that I was like, okay, well, I want to see what do I need to do to be a doctor? How can I, do that? And that was my initial catalyst exposure to wanting to be a doctor. And that's actually what led me to going to Xavier University of Louisiana, because one of its claims to fame is that it's the number one school college to getting African Americans into med school. And I'm like, well, I want to go to med school, so maybe I should go to this school. And so that is ultimately the main reason why I went to Xavier University of Louisiana.
Nice. Man, she must be had a amazing speech for you to be like, you know what? I see what I want to do now, and follow that pursuit and actually follow it to the end. You know what I mean? Because a lot of people will start something and they realize, this was a moment, but it's not really my journey. But that right there led you to your passion, which is leading you to your purpose, which is leading you to helping and making an impact with the public. So
yeah. And I think a lot of times when you get those types of speeches, you're like, I'm just giving a speech to the audience. I'm not even sure what type of response I'm going to get. So in October of 2019, I had the opportunity to meet her in person. And I told her basically the story I just told you, that she inspired me to become a physician and ultimately pursue public health. And she was so excited. She said, I didn't even think I had that impact. And I said, yes, you did. And so I was just really, really excited to meet her and be able to tell her how much she inspired me.
Nice. That's just like the motto of the t-shirt that I'm wearing now that you can get on Pill Talk Podcast. Empowered leaders, empowering leaders. So you never know who's out there listening to you. When you're in a position to be a leader, there's always someone looking at you like, you know what? I like this leadership style. I like this. And I want to pursue that because I want to be like this. So that's dope. So someone probably listening to this right now, Dr. Byrd, is like, I like her. I'm going to follow this same path too. So that's what's up.
No, and please let me know, slide into my DMs, or if you see me in public, please let me know, because I just love to inspire others.
That's dope. That's dope. Be an empowered leader and inspire others. That's the motto for this episode.
Perfect.
So let's get into it. Let's jump into it. So, what made you want to become a peds physician and infectious disease physician?
Okay, so I initially wanted to be an infectious disease doctor. So actually, my journey starts a long time ago in 2005. So I went to Xavier University of Louisiana for undergrad. And if you remember, August 2005 is when Hurricane Katrina hit. So I was actually there on campus when the hurricane hit, and I was one of 400 students and faculty that had to be evacuated from the campus. And so I eventually came home to Detroit, which is my hometown. And I was like, okay, what am I going to do? So Wayne State University graciously allowed students who are displaced from New Orleans to attend school for free. And I was a biology major, so I was like, okay, well, I have to take a science class, and I ended up taking microbiology. And that class was actually taught by a lot of physicians who called themselves infectious disease doctors. And so I'm like, because I honestly was coasting through school, like, I'm not really interested in many of these things. But, when we started learning about bacteria, viruses, and how they affect the body, I really was interested. And I said, okay, let me figure out more about this. Let me change my major to microbiology. And that was the catalyst that kind of put me on the trajectory to be an infectious disease doctor.
Nice. Just to start back a little bit, I know it had to be traumatic to be in that situation with Hurricane Katrina and having to be rescued and displaced. But something did come out of it. You going to the next university and finding your passion with microbiology. That's great, because a lot of people don't actually take like infectious disease or those type of classes seriously, because they think those type of classes are like the hardest ones. So they try to shy away from that. And you actually like dove head first into it. So that's good.
Well, no, I was told that this was the weed out class, because I was at this point interested in medical school. So, I hear the whispers in the background, this is a weed out class. Have to be, look to your left, look to your right. Half these people won't be here at the end of the semester. So I was like really nervous, but I was fortunate enough to really do well in the class and really enjoy it.
That's what's up. So that's how you got into wanting to be an infectious disease. All right, so that leads you down this path. So what made you want to jump into meds and peds, being able to be a physician for doctors and kids or pediatrics?
Yeah, so so at the end of my undergrad, I wasn't quite ready to go to medical school. I mean, to be honest, I was struggling with depression, and that kind of, because of my depression, I really didn't put my best application forward when I applied to medical school the first time, because I applied twice. So the first time I turned in my application late because, like I said, I was struggling with depression. So I did not get in. So I ended up instead going to get my graduate degree at GW, which is George Washington University. So there, I really was exposed to more microbiology classes, more infections. And I was like, okay, it gave me the breath that I needed to get my mental health together, to, really learn more about microbiology, and to allow myself to put forth a good application to medical school. So at the end of that program, I was fortunately accepted to Meharry Medical College, and I was ready to just see adults and be an infectious disease doctor. However, Well, I really, I never struggled. I was like, I know exactly what I want to do. Like, all I have to do is get through this so I can get to the next level. I had that type of attitude. I don't know if that was a good attitude or not. But someone told me, look at the extracurricular activities you've done in the past, what makes you happy. And I spent a lot of time, volunteering with kids, whether it was like in vacation Bible school, whether it was a summer youth camp, whether it was like as a counselor. So I really said, let me give peds a try too. So I really enjoyed it. And so I'm like, okay, this is the dilemma. I already know I want to be an infectious disease doctor, but now I'm interested in peds. Is there a way to do both? And, we're a rare breed, but there is, multiple people have done the combined adult and pediatric infectious disease training. So I said, oh, okay, well, I'm going to be a med peds doctor. So I'll be able to treat all the adults and children of all ages, and I'm going to specialize in infectious diseases. It wasn't an easy decision. I think the lesson that I learned from med school is that, I had this deep desire in my heart that this is what I wanted to do, but a lot of people didn't understand it. And because I had not met another adult and pediatric infectious disease physician, it was really hard for me to articulate what my career would look like and what that meant. I just knew I wanted to do it. And the lesson that I hope people get is like, it's okay if people around you don't understand your vision. The fact that you were given a vision is important and you should pursue it. So, and that's exactly what I did. And here I am.
Man, there's so much in there to unpack. So let's start from the beginning. Applying into med school and not getting in on your first try. So there's a little sidebar. It took me to my third try to get into pharmacy school. So going through that was like one of those things like self-doubt, going past naysayers, like, just trying to push yourself forward. So I definitely commend you for sticking to it because I know that's not a hard thing. Definitely in the situation that you was going to do that as well. So congrats on that. And I'm happy you did it because you're here now, So so you took the extracurricular activity and you did a course with the peds and you decided you liked that and wanted to keep pursuing it?
May I just kind of add a little clarity to that? So in med school, traditionally, your first 2 years are what we call your preclinical years. So these are the years that you're going to learn your anatomy, your physiology, your biochemistry. And then your third year is where you get your exposure to your clinical years, where you do your what we call clerkships. And I'll explain that shortly. Now, people who are interested in medicine know that now the trend is to get even the first and second year's exposure to patients, but typically that happens in the third year. So in your third year, the clerkships or rotations will range from 1 month to 3 months to 2 months, depending on your program, where you rotate through each specialty. So where I went to Meharry, so internal medicine was 3 months, surgery was 3 months, peds was 2 months, so forth and so on. So they give you an opportunity to rotate through the core specialties so that, number one, you know what it means to be a family medicine doctor or what it means to be a surgeon, because not everyone comes into medical school knowing exactly what type of doctor they're going to be. And then after that fourth year, there's an exam you need to take, but then you start applying for residencies, because everyone in the United States who practices medicine independently must complete a residency, which is specialized training. Because when you're done with medical school, you're not ready to be nobody's doctor. It's cute to have the MD-DO behind your name, but you don't really have the clinical experience to treat patients in your specialty well. So that is what residency is designed for. It is like a extended paid internship. So for me, when I said I got exposure, so I did my pediatrics, clerkship or rotation, and I really enjoyed it. And that sparked me to ultimately apply to the combined internal medicine pediatrics residency.
Okay. So there was something else in there you said you want to get into. I think we're talking about clinical ships or something like that. In the beginning, you're like, I'm gonna get into that in a second.
Oh yeah, so that's the clerkship. So yes. So the rotations are clerkships where you go through internal medicine, pediatrics, surgery, family medicine, psych, neurology, or everyone does that a little bit differently. Did I say psych? I think I got them all.
Okay. You spend a little bit of time in each one. So
exactly.
To be med peds trained, this was an extra 2 years of training for you?
So not exactly. So just to be an internal medicine doctor is 3 years of residency. Just to be a pediatrician is 3 years of residency. To do the combined internal medicine pediatric residency, they mesh those to just 4 years. And so the way they're able to combine that is you do a lot less elective time, which means that, you do mainly the things you need to get your certification to be a med peds doctor.
And while you're doing this, you finish this assignment or this residency, and then you start infectious disease residency.
Yes. So like every specialist has to have a general training. Yeah. Like, for example, a cardiologist does internal medicine training because, he or she will need to make sure they know the basics of medicine in order to be a good heart doctor. And in fact, like every organ system, every part of the body can get an infection. That is why it's really important for you to really know how to treat an adult in general and how to treat a child in general well, so that when you start to add infection, that you're able to recognize what's normal for a child and what's not normal. What's normal for an adult and what's not normal in terms of infection and what you see.
Nice. All right, speaking about infections and things like that, it's a little off topic, but on topic. Since we're going back to school now, do you have a couple tips about kids going back to school and avoiding catching infections?
Yes. Okay. I have a lot of tips, but I'll give you just a few.
Share a few.
So I think that it's really important for kids to wear masks. I know this is a very political, hot topic, but let me tell you why. So I believe that children starting from the age of 2 years old and up should wear a mask because it just overall decreases infection in general. So when the U.S. had mask mandates, meaning that, indoors you absolutely had to wear a mask and so forth and so on, we saw a lot less kids coming into the hospital with serious infections, especially viral infections. However, now that, the mask mandates have been relaxed, now we're seeing things like influenza and RSV, which is like respiratory syncytial virus. We're seeing things like that we weren't seeing, when people were wearing masks. So this is one way I think that kids can really protect themselves. Additionally, it's important to remind your kids to wash their hands or use hand sanitizer frequently. This is like basic, like, oh, I already know this, but like really telling your kids to be diligent. Another tip is teach, especially small children, to kind of cough properly. If they have to sneeze or cough, try to cough in the elbow or, cough in a tissue as opposed to their hands. And if their hands do get, have a little mucus on it, that making sure that they're washing their hands and or using hand sanitizer, this is going to decrease the rates of infection in kids. These sound so simple, but sometimes the simple things are the best things.
Yes.
And, I am a vaccine advocate. So I do recommend that all children 6 months and older get the influenza vaccine, as well as for children who are old enough, get the COVID-19 vaccine. And if anyone is concerned about, I don't know about vaccines, they are more than welcome to discuss this further with their healthcare provider.
Yes. Since you mentioned the COVID vaccine, I do have a question because, I'm a retail pharmacist, so I give out the vaccine and I get these questions a lot. I just have to talk with people in counseling on the pros and cons of the vaccine and everything like that. But I don't want my audience to hear it from a physician, an infectious disease physician to be precise. What are your thoughts on the COVID-19 vaccine? If you don't mind sharing those with us, please.
Yeah, so I think that I am like I said, COVID-19 vaccine advocate. I do think that it's really important that as many people as possible who are eligible for the vaccine get vaccinated. Why is this? Let's just kind of go back in history. So when you're thinking about let's just go back. How do vaccines work? So vaccines work by, you get the injection, and basically, specifically with the COVID-19, we're not giving you the actual virus, which is called SARS-CoV-2. We're not giving you the actual virus. We're just giving you something that's going to, make your body respond to the spike protein that's on the real virus, if you were to get it. So I think if you get the vaccine, and the vaccine kind of prepares your body for if you are exposed to the virus. So I think by creating what we call an antibody response. So I tell people, think of this antibody like little soldiers in your body that are just ready to fight. They're not going to fight when they aren't, they don't need to, only if you're exposed to the virus. If you're exposed to the virus, then they're like, okay, I'm going to attack, so that you either don't have symptoms or your symptoms are very mild. So that is the reason why it's important to get vaccinated. The other thing is, and this is why I think it's important for the vaccines in this pandemic, is we know they work. One of the top 10 public health interventions in the 20th century was vaccination. Why? Because it led to the elimination of smallpox. It led to the elimination of polio almost worldwide. There's few other countries that still struggle with polio. A lot of diseases like Haemophilus influenza, like measles, people were dying from back in the day, but we don't see that now. So we know that mass vaccination can really decrease, if not eliminate, a disease in a community. So that is in general important. So to answer your question about, and let me know if I'm going too fast.
Oh, no, you're doing great. You're doing great. Give them that education. You already need the history lesson.
So let me go back to specifically the COVID-19 vaccines. So do I believe they're safe? Yes. So there are two what we call mRNA vaccines, which are the Pfizer and Moderna vaccine. And then there is the Johnson & Johnson, which is that one-shot adenovirus. So based vaccine. So in general, these vaccines have been shown to be safe. The most common side effects are, soreness at the injection site. Sometimes people have body aches, fever. Sometimes people have lumps or bumps under the armpits, which we call lymphadenopathy. And this is just your body producing that antibody response, those kind of soldiers. So a lot of concerns people have are like, oh my goodness, this vaccine is going to just stay in my body forever. And that is not true. the response to the vaccine is going to stay there, but the vaccine itself gets degraded. So that's number one. Two, people are really concerned about fertility. They feel that they don't want to get the vaccine if they're trying to have a baby. And I know plenty, and it's based on a lot of faulty, evidence that happened early on in the pandemic. There was concern that the spike protein was very similar to a protein in the placenta. And if you were to get pregnant, it can make, cause issues with the baby. But that has proven to be not true. I know plenty of people who have gotten pregnant after getting vaccinated or got pregnant or got the vaccine during pregnancy, and their babies turned out beautiful and healthy. So those are just some of the concerns people have that I think that are unfounded. Unfortunately, the misinformation has gotten a stronghold in this country for a lot of different reasons that I won't go into. But the vaccines are generally safe. There are some, issues like, for example, the Johnson & Johnson vaccine did have an issue with the blood clots in women of reproductive age. That is extremely rare, association, and they're not quite sure if it was totally related to the vaccine. The other thing is for the Pfizer and Moderna vaccines, some kids have come in with like inflammation around the heart, but they've never, no one has died from this, and they all recover. And again, that's an extremely rare complication, and that's extremely rare compared to actually getting COVID-19 and the blood clots you get from having COVID-19 or the heart problems you have from COVID-19.
I do got one more question about the COVID shot.
Yes.
So it's a 2-shot series. And a lot of people come back and say, hey, after that second shot, I was more tired. I was more like I was bedridden for a day, if that's the correct term to say. But they was a little more down. The body was had a bigger effect to the shot. Can you go on and explain why that happens so people can understand when you get the second shot, what your body is doing to protect itself and why you do have a slighter, bigger reaction?
Yeah, so I actually think that reaction is variable. I got my second shot, I felt great. I got Pfizer. I have an identical twin sister who got her second shot, and she got Moderna, and she felt great too. Our first shot was worse than the second one. So it's so variable, but I think that it's just related to that just some people's bodies just really kind of ramp up a strong response to the vaccine to the point where people feel sick, where fever, I just feel like I have the flu. And if you have that response, then great. That means your body really ramped up to it and responded to it. If you got the vaccine and you didn't have that response, don't worry, you're still protected, because a lot of science and a lot of work has gone behind knowing how much of the vaccine to give and how frequently to give it. So don't worry, you're protected too.
Man, that's some great information, man. I appreciate you sharing that. Man, it seems like you probably should be working at the CDC with all this knowledge you have.
Well, I'm applying for a job at the CDC, and we will see if I get in. So that's all I can say about that.
Hey, I understand. And hopefully you get it, because, that's in your field. You need representation there of minority providers and physicians. So hopefully you get that. So, all right. Where do you see your career going 5 years from now? Because you have a lot of knowledge, a lot of information to give. It seems like you probably are like an educator, and because the way that you're providing this information to my audience. So if you don't mind talking about that, where do you see yourself going at or leading to in the next couple of years?
Yeah, so I love seeing patients, but I do see myself pivoting to a career in public health. Specifically, doing this with you is what I really enjoy. I specifically want. So, I would love to be in a position where I can break down complicated, science, especially when it relates to infections, to community leaders, to people in politics, so that they can, so as to inform policy and hopefully create policy that betters the health of the population or of the people around me and my community. So I am not sure what that is going to look like. I'm not sure if that's going to be at the CDC or a state or local health department or academics. And I'm very open. I have a lot of, coals in the fire. So we'll see. You have to bring me back in 5 years to see where I am.
Will do. I will hold you to that. We'll hold you to that. Pill Talk Podcast is 1 year down and many more to go. So 5 years from now, we'll be looking you up. So I know your YouTube channel and on your Instagram, you share a lot of knowledge with people. That's why I say that, you have to be an educator of this. I find a lot of your reels are very educational. And it gets to the point to be like, okay, these are the tips. These are what you need. And I understand that's a passion of yours. Like, what do you see yourself, like, keep making these? Are you talking to the community about different infectious diseases? How are you keeping this word and knowledge going forward?
Yeah, so I'm fortunate enough to be, I'm, in addition to what I do online, I'm practically doing it where I am. So as I said, I live in Rhode Island. So I'm working with the Rhode Island Ministers Alliance to really work and continue the work in regards to vaccinating, as well as providing COVID-19 tests to people of color, specifically Black and brown people. So I'm also working with a few other organizations. So I'm not just like online, like I'm also like in real life, doing the work, and really I think if this pandemic has taught us, like, you have to reach people multiple ways. We were really kind of dependent on really meeting people. Okay, I'm going to come to this meeting. I'm going to meet you for coffee. I'm going to talk to you. I'm going to make this speech. And really, we had to lean on technology and social media to really get good information and get the word out there. So I see myself as really reaching back to the community, because some community leaders are of a different generation. And when I say different, I mean older. So it's just really challenging to create reels or create TikTok or, create like digital content. So I'm not a social media influencer yet, or, like an expert, but I do lend what I know to local community leaders just to say, hey, what about this? Or how can we do this different? Just to kind of increase the reach. And so I think that we need new blood in our community advocacy streets, especially when it comes to medicine, especially when it comes to, really breaking down a lot of complex information to people. Like, for example, I'll give you a specific example. So, Pfizer is currently doing phase 2 and 3 clinical trials looking at the safety of and efficacy of COVID-19 vaccine in children 5 to 11. Yesterday, they released a press release on the information. I'm waiting for the publication. So it's like, how many people is going to read the New England Journal of Medicine, when the article, like when they publish it? Not many people. However, they want to be able to like get a summary. What do I need to know? Like, how many people did they enroll in this study? What was this? And so I feel, that I'm in a space and have the opportunity to be like, look, I'm breaking this down, because they'll be like, look, they didn't have Black people in that study. And I'm like, actually they did. They didn't really test the safety. I'm like, actually they did. And this is the facts. And so I think that space is really important. And so
Yeah.
I love talking, as you can see, and I love to teach people and share, new information. So
Now you made a valid point. So some of these, like you said, these community leaders now are of an older age, and the connection between the youth and them getting a little more distant. So we do need that buffer in the middle to come in there and be like, hey, all right, I hear what you're saying, but to translate this to them, we need to say it this way. We need to make it funner, because a lot of people will just try to come through and hit you with the knowledge or just give you something, some information, but it's not retainable because it's not in a way that you can accept it. So with you coming in and giving out your content, your information in a more like funnier way or something that piques someone's interest to make you look at it and be like, oh, she picked the medicine and the candy per se. And that's what we really need right now with our youth and things like that. So I appreciate you for going out there in the community of Rhode Island and touching the people.
Yeah, no, I enjoy it.
All right. So it seemed like you got a real trying job where you got to do so much, because within a fellowship, you still technically studying and learning, but you all working. So how do you find the work-life balance to keep everything balanced, to keep everything moving forward?
It's stressful. It is not easy. This is work-life balance is what I struggle with, to be 100% transparent, because you're right. So I'm currently studying for my pediatric boards, which is like in 20 days. And so doing that, plus going to the hospital, seeing patients, plus doing a social media thing, plus doing community advocacy work is very stressful. So what I try to do is to give myself deadlines, keep a planner, and try not to overcommit. I think that's when you're interested in a lot of things and you're doing a lot of work, I think it's really easy to overcommit, and just be transparent and say, look, I can't. I know I can't. And like, no is a complete sentence, and it's healthy. So yes, and so it's like it's something that I am still working on, to be honest. But I'm doing pretty good. I feel great. I worked out today, doing big things.
That's always a great stress reliever. Trust me when I tell you.
Yeah.
So seemed like we covered a lot. Seemed like you gave us some great tips on sending your kids back to school sending your kid back to school to avoid infectious diseases. Learn a little bit about you, why you got into this, how you impacted people's lives. Is there anything else you would like to say to the audience, Dr. Byrd?
I'd just like to say, to you, thank you for having me. And to anyone out there, if you are interested in being a doctor or interested in infectious diseases, please reach out to me. I'm more than happy to answer any questions you may have about that. My overall advice to anyone thinking about pursuing medicine is that it is not for the, faint of heart. It is very challenging field in a good way, but you will have to sacrifice time with your family, sacrifice your social life, sacrifice some years, but at the end of the day, it's worth it. It's no greater joy that I have to really someone to say, you know what, Dr. Byrd, thank you for really helping my child, or thank you, for saving my life, or thank you for doing what you do. I personally find joy in this, and I know that this is because of that. I know this is my purpose in life. And so at the end of the day, whether it's medicine or whatever, that's why I say pursue your purpose and your vision wholeheartedly, because when you're operating in your purpose, you'll be happier. Things will just flow. It's not going to always be easy, but you'll be so much happier.
Nice. So if those people out there listening to this, they're like, you know what? I want to follow this path. Or I got some more questions about this. They just want to get your contact information. So can you let them know your website, your YouTube channel, your Instagram, all your social media, so that way, if somebody want to get in contact with you, they can find you.
Yes, so you can visit me on my website. It's www.katrinabyrd.com, or it's www.katrinabyrd.com. It has all my social media handles, but specifically follow me on IG at dr_KBYRD. Again, that's at dr_KBYRD.
Nice. So thank you, everybody. This was another episode of Pill Talk Podcast. We had Dr. Byrd on, giving you your daily dose of medicine to be motivated and inspired to live at your full potential. So until next time, see you later.